Hello, everyone. I'm Jack Knott, and I'm the Dean of the USC Price School of Public Policy, and I want to thank you for joining us today for this important discussion. It's going to be led by Dr. Laura Mosqueda, Dean of the Keck School of Medicine. I'm really pleased that Dean Mosqueda is offered to provide this presentation about COVID-19, its current medical realities, and what the future may look like. On a recent call with the deans, she began explaining some of what you will hear today. And all of us in the dean's meeting found what she had to say so interesting and valuable that we wanted to ask her to share it with our community to hear this same information. Dean Mosqueda is obviously on the front lines of this pandemic and has great insights to share with us. She's widely respected authority on geriatric and family medicine, elder abuse, and the care of the elderly and underserved. And she's been really a wonderful leader of Keck with a strong vision for groundbreaking research, biomedical education, and as well, social justice, which is hugely important. As Dean, she has strengthened internal and external community relationships, including creating a new Office of Community Engagement, an Office of Leadership and Wellness, an Office for Social Justice, and the Center for Gender Equity in Medicine and Science. So I'm really grateful for her leadership, especially during this really difficult historical moment. And I want to thank her for taking the time to be with us today to share her perspectives and insights. And before I pass things over, I just want you to encourage you to ask any questions you might have for Dean Mosqueda in the chat function. And you can share those with the group or privately with Harley Ham, our Director of Programs and Events, who can help moderate the discussion and question and answer at the end of the discussion. So now please join me in welcoming Dean Mosqueda.
Oh, thank you very much. It's really a pleasure to be here. I happen to be a fan of Dean Jack Knott and certainly have been grateful for our relationship and our school's relationships. And maybe as a result, I'll get to meet some of you in person when it's safe to do so. And we'll talk about more collaborations that we could be doing. So I appreciate this opportunity to talk to you. We have been doing these community corners, and I had started out really doing them for our community, meeting like business leaders in East Los Angeles, faith-based communities, folks who run senior centers, and then realized, hey, we've got our own community here at USC, and that this is something that we could be doing with our sister schools. So it's been really enjoyable to do these sessions. I'm going to talk just briefly about the illness, a little bit about numbers and curves, testing. I'm going to hit you with some basic biology on all this, just so that you understand what this virus is doing a little bit more. Then we'll talk about prevention and treatment and open it up for Q&A. So I'll probably be talking for 15 to 20 minutes, and the remainder of our 10 to 15 minutes can be used for Q&A. Well, as many of you probably know, the majority of people who get COVID-19 either have no symptoms at all or very mild symptoms that they might not even realize was a symptom of COVID-19 until using what we call the retrospectoscope. They can look back and say, yeah, you know, I did feel a little bit off a few days ago. I did have some muscle aches or whatever. And then we have a substantial number of people who have some degree of symptoms. And the typical symptoms are muscle aches, a sore throat, cough, and a fever. Particularly, we hear a lot about night sweats that are going on. And then some people become so ill they need to be hospitalized. They may even need to go into the ICU. And of course, we know that people are actually dying from COVID-19. And those are tend to be the people who I take care of as a geriatrician. Older adults are disproportionately affected. We're certainly seeing this rampaging through nursing homes. I know I'll be very careful. Sunday, I'm going to be doing a house call on a woman who's 102. And we're going to be very careful going into her home. All right. So, oh my goodness, what a crazy thing for me to be showing you in the early afternoon. So forgive me, but let's just try to go through this briefly so you understand a little bit more about what we're talking about when it comes to the virus and some of the testing we're doing. And I'm gonna try and use this laser pointer here. This is the virus here, the coronavirus that has entered your body. And inside this beige area where I have the pointer is your cell. So what happens is the virus goes and it locks onto a receptor in your cell, most commonly something called the ACE2 receptor. And there are a lot of these receptors in the respiratory system, which is why this virus really tends to affect our respiratory system because of the predominance of receptors in that area. And once it gets into a cell, it takes over the cell and begins to just turn the cell into a little virus manufacturing machine. And once it does that, it then is able to produce and spit out the virus into your bloodstream. And when circumstances are good, you have cells, we'll just call them APCs, cells that gobble it up, and that cell then presents itself, now that it has the virus inside, to something called a T helper cell. And the T helper cell then tries to activate two systems. One system, called the cytotoxic T cell, goes after cells that are infected with the virus and tries to get rid of them from our body. The other system it activates through something called B cells actually produces antibodies. And we're going to come back to this slide 2 more times, so don't worry about memorizing it right now. By the way, all the slides are going to be available to you. Once it activates a B cell, it's that B cell that starts producing antibodies. So we have one mechanism that through the T cells that actually goes after cells that are infected, and we have another mechanism through B cells that actually creates antibodies that go after the virus itself. All right, with that as a backdrop, that's the journey of the virus. What about the journey for you as a person? Well, what happens is all of us, for most of us anyway, are susceptible to getting the virus. And so we have a point at which we're exposed to the virus. And interestingly, the virus can incubate for a couple of days or even up to 12 days. And part of what I want you to get out of this diagram is why it takes so long to know what's going on with the virus. So once we do things like shelter in place, this thing doesn't just turn around in a day or two, get you sick, and then you're over it. It takes weeks. And that's why it's hard to tell what the effects are of our different things like sheltering in place, use of masks, hand washing, et cetera. So once you're exposed, that the virus can incubate for 2 to 12 days in your body. And once that machine is turned on, right, it's taken over your cells, it's manufacturing virus, and you're starting to shed the virus, that's when you become contagious. Now, for the first few days that you're contagious, you might feel fine. You might not even know that you have any illness, and you might continue that way, or you might start to get symptoms, mild, moderate, or severe. And during that time, when you're infectious, you are shedding virus and can be contagious to other people. And it really isn't until you've been symptom-free for about 72 hours that you no longer are shedding the virus and you're no longer contagious. And that's why we ask people who are COVID-19 positive, you're feeling miserable, you got muscle aches, you've got a fever, and now you start to feel better. Wait, you gotta wait, because what we're seeing is that sometimes it comes back a few days later and you feel sick again. And then once you're really symptom-free for 72 hours, no fever, and it's not because you're taking acetaminophen, you really don't have a fever, we're ready to say you're no longer contagious, you're ready to go back out into the world. This is the patient's journey with the virus. All right. Now, a few numbers about what we're seeing in Los Angeles County. Be careful when I show this. This doesn't reflect the entire population. This only reflects the people who are getting tested for COVID-19. And what you'll notice here is that about 33% of people who are COVID-19 positive are between the ages of 18 and 40. And you'll also notice it doesn't seem to be affecting children very much at all. And this is kind of interesting then when you look at this graph, which looks at who's getting hospitalized as a result of COVID-19. And what you'll see on that steeper slope, the red line, those are people over the age of 65. And if I showed you the slope of just people over the age of 85, it would even be steeper. So even though certainly people between the ages of 18 and 40 get COVID-19 and become positive, their likelihood of getting a severe illness is dramatically less than those who are have chronic illnesses, and particularly with older adults who have chronic illnesses. All right, let's talk about testing. You got to be careful these days because we've got two kinds of testing that occur. One is called diagnostic testing, and that you might also hear referred to as PCR or RT-PCR. And the diagnostic testing says, do I have the virus right now? And then there's serologic testing, which tests for presence of the antibody. And I'll go into more detail about each of those in subsequent slides. I warned you this one was going to come back, and here it is. So you'll remember this is the virus's journey through your body. And when we are doing testing, diagnostic testing, we're looking for presence of the virus. So we're looking to see whether that virus has taken over your cells and it's spewing viral, active viral particles into your blood. And that's when we're doing this diagnostic or PCR testing. So that's why we do things like stick swabs way back into your nose, where we can actually get some of the mucus and test it for presence of the virus. We're hoping very soon that instead of that, it's not horrible, but I'm sure it's not the most comfortable thing in the world to have somebody stick a Q-tip up your nose. Pretty soon, we're going to be hopefully moving to saliva sampling once we really verify that it's a good, valid, reliable method. And this is the testing that says, right now, do I have virus present? Now, for those of you who might be concerned or get concerned that you have symptoms consistent with COVID-19, there's plenty of ways for students, faculty, and staff to contact a healthcare professional and to get tested safely. We don't want you just coming into the emergency room or the doctor's office, because if you are COVID-19 positive, we don't want you giving it to everybody else. So we have safe ways for you to get tested. Again, these slides will be available to all of you, so you can take down the phone numbers and web addresses later. Back to the crazy slide we just talked about. This is what the virus journey looks like in your body to a certain extent. Diagnostic testing. Now we're going to look at serologic testing, because serologic testing is what looks for the presence of the antibody. And again, the antibody is what gets produced. It's a protein that's produced by the immune system in response to an infection. There's different types of antibodies, and the other name for an antibody is immunoglobulin, which is why they're abbreviated as IG. And what you'll see in this picture is that green guy is the COVID-19 virus, and the yellow guys are the antibodies that our body produces. And the IgM is detectable quite early and then goes away. And the IgG gets detected a little bit later. And now I'm going to show you another crazy looking graph here so that we can just go through this. And again, it's just to educate you so it'll make sense when we're talking about these different kinds of testing. I hope you're putting up with me okay here. This first line that you see is what's going on for the person when you get infected. So let's pay attention particularly to this line, that's the red line, because that is the IgG antibody. And what you'll notice about this line is that it starts to rise a week, 2 weeks into the course of an illness and becomes detectable around 2 weeks, 3 weeks in. And then instead of going away, like you see with that green line, that a type of antibody called IgM that comes and goes, this IgG is the one that we hope stays and confers longer term immunity. And that's why when we're talking about antibody testing, everybody was excited, like, great, we can do the antibody testing. If we test you and you have IgG, it means you've had coronavirus, and now it means you're immune to it. And fortunately, that's not quite the way it seems to be turning out. What we don't know yet is how good these positive or negative antibody tests are, because there still is probably a relatively low prevalence in the community. Unless we have a highly specific antibody test, we can end up with a statistical conundrum of not knowing how reliable it is if we say you're positive for the IgG antibody. Again, I think with work being done by colleagues in your own school and others, we're learning a lot more about this. And it still is a reasonable test to be using for getting a sense of what's going on in the population. But what I want to be careful about is that question I put at the bottom. How do I use that information? This is where I want people to be careful and not say, well, great, I'm IgG positive, I'm immune, I'm golden, I can do whatever I want to do. Not so fast, because we don't yet know how good that immunity is. And we have found that some types of immunity are better than others, and some types of IgG are better than others. So it doesn't tell us about either the quantity or the quality of your IgG. And until we have a better understanding of that, we really won't know how well immune you are to a recurrence of COVID-19. Our best guess is that you're in pretty good shape. That's our best guess. But boy, if it were me and I tested IgG positive, I would not be thinking that that's a get out of jail free card. So we still want people to be very careful and not to think that you can start going out and interacting with people again because you're immune. We don't know that for sure yet. And you could still be dangerous to other people. So let's talk about prevention and treatment for a minute. Really important to continue the physical distancing, hygiene, washing your hands with soap and water. If you don't have that available, using something that's at least 60 to 70% alcohol-based gel. Lots of vaccines in development. I really hope they'll be available to us within a year or so. And then a lot of different treatments available. And the treatments range from, hey, once somebody has mild symptoms, can we do something to prevent them from getting worse, to people who come in and are severely ill to prevent them from dying and to really help them with recovery. So a lot of really, I think, good positive news on the horizon. We have a lot of tests going on here at Keck, clinical trials, a whole variety of things from basic to social science that we're looking at. So really important to help mitigate situation in our communities. Please, on behalf of old people, particularly old people who have chronic medical conditions, let's be kind and really limit our activities so that we don't get folks sick. We never know who walking around with us is immunocompromised, maybe getting chemotherapy for cancer, et cetera. So we really have to be careful for not just our own sake, but for society's sake. You also have to be careful for yourself. It is so important. This is just, this is whole situation of what people are calling social isolation, a term that I do not like. We want physical isolation. Can make you a little bit nuts. We've got to give ourselves a break, because you just end up sitting and listening to the news, and you're not learning anything new really, but it's just can get people ramped up into quite a frenzy. If you're going to wallow, that's okay. We all need to wallow, but make it a time to wallow, and then listen to some music or go for a walk. Bring a mask with you and get out of it. I do want to say that, this is a time when whatever our past experiences are might make it even harder for us to cope with this. So if you're finding that you're really anxious or feeling really low and can't get out of it, hey, call us. We've got fantastic mental health professionals available. We're here to help, and we want to help you get through this in as healthy a way as possible. Be kind to yourself. Be kind to other people. It turns out being kind to other people is not only good for them, but it's good for you. It's good for your immune system. And of course, we want people to stay safe and don't engage in reckless behavior. So physical distancing, not social distancing. Stay socially connected, please. Reach out to each other so that if you see somebody who's struggling a bit, that's a great time to let them know you're there for them. All right, so let me turn it over for a little Q&A. And I hope this was helpful.
Okay, great. Thank you so much. And we are getting some questions, so I'm going to start. First one is, because the likelihood of a vaccine by next winter is low, what would it take to test everyone in the USA for COVID-19? And how long would it take to ramp it up to make that happen?
Yeah, let's see. Oh, what the hell? I'm going to get political. I think that what has happened in the United States federal government has been shameful and beyond disappointing. And so I don't know what it'll take to get everybody ramped up. I mean, it was just every health system for itself scramble to get adequate PPE and adequate testing. So it does look like things are getting better with testing, that we're going to have adequate supplies for testing. But still, the idea that we're going to be able to test everybody every day for everything, I don't think is reasonable. I think that once we have solid PCR testing available now, so that if somebody has symptoms, we're able to tell whether or not they have virus, and we're doing really well with that. The antibody testing is still getting up and running, but testing is going to be one component of our strategy for getting back to business. But it's just going to be one component of it.
Okay. You kind of touched on this, but somebody did want to know, when do you expect the medication being in the market available?
It depends on available for what. So there's been a lot of press. Dr. Fauci was just announcing an antiviral medication called remdesivir that's very promising. We always want to be, and there's many more in the pipeline. There's old medications that have been used for other purposes that look like they might be effective. We don't know if we're going to get a treatment that really knocks out the virus early on. I mean, we talk about it's really limited. How long has the flu been around? We still don't really have great medications for the flu. And then there's other viruses that we are more able to treat. There's a lot in the pipeline, so I'm really hopeful that we're going to get to early and better treatments quite quickly.
Okay, the next question is, now that LA is offering virus testing for everyone, what's your opinion on elderly people who have avoided contact with others for the last 7 weeks, no symptoms, to get tested?
If you're not having any symptoms, I'm not sure how the testing will help you unless you've been exposed. So if you've really been sheltering in place, you haven't been exposed to anybody, you've got no real reason to think that you're likely to be positive, it might not be necessary. I wouldn't consider it necessary to go out and do that. If, on the other hand, you're an older adult where you do think you've had an exposure, it would be reasonable to get tested so that you can be vigilant for symptoms, because you are more likely to display symptoms and more likely to become ill.
Okay. This question is from someone watching on our Facebook live stream. What is the accuracy of the testing?
The PCR testing, it's very accurate. So I don't know the numbers in terms of sensitivity and specificity, but they're north of 95%. So the testing tends to be very good. Now, what you need to be careful about is it's very good if the virus is present, but what we're finding is somebody might be very, very sick with lower respiratory symptoms, meaning the symptoms are really in their lungs, and you do the testing in their nose, it comes up negative. It becomes up negative because that virus has already made its way down into the lungs. So it's accurate in that there's no evidence of virus from the what we call the nasopharyngeal swab that we took. But if you were actually to do a lavage and get a little bit of fluid out of the lung, that would test positive, and we've seen that now. So the accuracy of the testing also has to do with whether you're catching the right cells at the right time for presence of virus. Did that make enough sense?
Yep.
Yeah. Okay.
The next question is not really a question, it's more of a comment for you. A viewer wants to know if you can comment on the effect of ACE inhibitors as well as the effect on smokers.
Okay, so ACE inhibitors, even though we're talking about that particular ACE2 receptor, ACE inhibitors are a separate conversation from what's going on with the virus. It's just that it's the same receptor, but that's a different mechanism than related to ACE inhibitors. And without going into the physiology, I'm just going to leave it at that for now. And then the second part was smokers. Yes, people who smoke almost by definition have lung damage. And when you have lung damage, it makes you more susceptible to any illness, including COVID-19, that affects the respiratory system.
What exactly is an antiviral medicine like Tamiflu, and why are antiviral medicines not as effective?
Okay, so it's a little bit like thinking about an antibiotic. You don't use the same antibiotic for every kind of infection. And the same antiviral medicine doesn't work for any virus. So it's really analogous to an antibacterial kind of medication. It goes after the virus itself, And because viruses are different, there might be some cross-reactivity, but the antiviral medication might be fairly specific to that particular virus.
The next question is, what is the possibility of getting a second wave of this virus, and do you think we are better prepared for it?
Yeah, it does. So the best guess from both epidemiologists and virologists is that there will be a second wave. And I think we're going to have to learn how to live with it. I think it's going to kind of come and go. There's likely to be some seasonal variation to it. But a lot of people, educated guess is expecting it to come back fall and winter. We are absolutely more prepared to deal with it physically, economically, emotionally, in every way you can imagine. I think there's so many lessons learned from this, and we'll all kind of know the drill if this comes back, both in terms of our healthcare system, for our classrooms, for ourselves, for our loved ones. So we'll be much better prepared.
Okay. And what is your best recommended treatment for coronavirus fatigue? The reaction to today's potential beach reclosures has been quite alarming, considering we may have to pull back in the future because of cases reemerging in our community.
Yeah, it is such a drag. This COVID-19, it takes so darn long to see the effects that when people start getting back together, it's 2, 3, 4 weeks before we start to see the curve go back up. And so, human nature is such that we want to see cause and effect happen very proximately to each other. And that's just not the way this is. And you're right, this thing is exhausting. It's physically exhausting, it's emotionally exhausting. And that's why I think it's really important to look at self-care. Exercise is a very important component to avoiding coronavirus fatigue. Protecting yourself so that you're not constantly listening to just coronavirus news. There's plenty of other important news still going on in the world that you can get a hold of and pay attention to. I think meditation is a very good technique and a great thing to learn at a time like this. Reaching out to other people and having these conversations. And that's why I don't like social distancing. I want people to stay socially connected and just spatially distanced. And if you're finding that I was just going to say, I just again want to remind people that if you're getting down in the dumps and the fatigue seems to be really weighing on you, to reach out and get some help.
Okay, I'm going to do 2 last questions. One, will people who are asthmatic and have autoimmune disorders ever be able to get back to life before a vaccine?
Yeah, we just want you to be extra careful, right? So this is all about probability and risk. So anything you can do to decrease your exposure, anything you could do to decrease the probability that you're going to be exposed to COVID-19 is what you need to do. So if you have, for example, asthma and autoimmune diseases, then if somebody else can do things like go to the market for you so that you can kind of preserve your activity of going out, of doing something more fun, you still want to limit it, but maybe limit it to the things that are more meaningful and purposeful and enjoyable to you.
And then the last question I will end with is, how are the students at the Keck School dealing with the virus?
Well, we have a variety of students here. So we have a lot of students getting masters in public health and masters in global health, and they're just learning a huge amount about this and have just been absolutely magnificent in terms of digging into the public health efforts. Our medical students have also been remarkable. So we have our rising 4th-year medical students ready to go back onto the wards in just a couple of weeks. We're doing it very, very safely, but of course our students want to be in there, and they've been doing an amazing job. And it's everything like our 1st-year medical students have this program where they are reaching out to older adults who are isolated at home and staying in touch with them over things like FaceTime, talking to them about symptoms. And we have students who are helping with food programs. We have a street medicine program where we deliver health care to people on the street. We're having to do that socially distanced. Yeah, our students have been magnificent. I know I'm biased, but they've been magnificent.
Well, thank you so much for today's informative session. We really appreciate it. We will be posting both this video as well as the slides from today on our website. And please join us next week for additional Price Talks Policy in the Pandemic. Thank you all for joining us.